we have a huge problem with human resources on continents in Africa. We don't have enough healthcare professionals, community health workers, and AI's most exciting potential is to help us solve this gap.
AI is leapfrogging here on the African continent faster than it is in other places, almost building up to an M-Pesa moment here on the African continent. Obviously, there's a lot of challenges and a long way to go in terms of infrastructure and internet and data literacy, but there's huge potential and it's really already happening, and there's a lot of energy behind it.
There is that skepticism that started when it came to what AI is going to do, but once the healthcare providers have been told and taught about AI, they've come to embrace it as a tool that helps them in decision making. And that perspective and change of view from something that is taking over my job to something that I am using as a tool is driving the work that they're doing at speeds that are unimaginable at the moment.
People should know that there's huge opportunity in AI, and that actually many of us have actually been leveraging AI for years, way before people knew what ChatGPT or Llama was. The reality is AI can support those of us who are working in environments where we've had challenges with our clinical education systems, where we've had health workforce shortages, to help us really improve how we provide standardized and personalized care at scale so that we ensure we have a healthier, happier, and more productive world.
There needs to be active involvement of governments, especially in ensuring that capacity to harness the power of AI is developed equitably. So this means, all the way from ensuring that this kid in primary school in a rural village has access to opportunities to develop their interest and skills that will then develop over the years and eventually allow them to lead the development of solutions, AI-driven solutions that are appropriate for their context.
Physical and digital literacy and infrastructure needs to be addressed. I think internet penetration, access to power is still lagging behind, which limits the ability to use large language models in their current state. And I think that there's a lot of potential in small language models as well that could actually be deployed locally on a phone that could really bypass some of this. So really focusing on infrastructure and thinking about the ability to use smaller language models for less complex tasks.
The global health community should focus on safety of data and sharing of information and awareness about the use of AI tools in healthcare.
So by strengthening that regulatory architecture, by strengthening the capacity in country to be able to assess the ethics and the integrity of these systems is really our first step. When we go from there, the next step is benchmarking. We need to be able to help governments and implementing agencies differentiate from what is a good AI model and what is perhaps a less good AI model.
And this year I'm really excited for all of our grantee partners that are working on really testing and evaluating LLMs and generative AI to see how they can be accurate, safe, and relevant and localized in a lot of the countries where we work. I think it's really important to consider the different contexts for a lot of the healthcare workers and the challenges that they're facing, and to make sure that we're developing tools that are not just shiny and cool on a computer screen, but that can really be implementable and make frontline workers and healthcare workers' lives easier and better.